Hello, my name is Tim Meadows, and I'm the CEO of Snowline Hospice in Diamond Springs, California. We are a 41-year-old 501c3 that relies on community support to fulfill our mission of supporting patients near end of life and guiding loved ones through grief. Our hospice care is focused on providing comfort with symptom and pain management, emotional and spiritual support for patients. We do this by providing physician, skilled nursing, social work, spiritual care support, hospice aid care, and support within that patient's home, whether it's a private residence or a care facility. We also provide bereavement support to the patient's loved ones for up to 13 months following the patient's last stay on Earth. For patients who are earlier in their disease process, Snowline also has a palliative care program named Supportive Care that is provided by a specially trained team of doctors, nurses, and other specialists who work together with the patient's current doctors to provide an extra layer of support. Thank you.
The name of our grant is a nurse-led home-based palliative care pilot to improve the quality of life for patients with advanced dementia in rural populations, and we're requesting $26,000.
So this grant will cover patients that live in the western slope of Dorado County. This county is known to have an aging population and increasing patients who are living with dementia. And we hope to support the patients with dementia and their families. These patients often are not supported by palliative medicine or other programs and have a high risk for hospitalization and emergency room. Their caregivers often have high risk for caregiver burnout. We have been doing home-based palliative care for almost 6 years now, but most home-based palliative care programs support patients with cancer, COPD, or cardiac disease, and we're hoping to extend that to dementia patients. These patients are often in their home, taken care of by their family, and frequently there is high needs to help understand the disease, to help support the family, to find resources and caregiver support for their families. And we hope by having discussions with the patients and families about their disease, the disease trajectory, and setting action plans to help prevent emergency room and hospitalizations, that we may show increased caregiver support, reduced hospitalizations and emergency room visits, and overall improved quality of care for our patients living with dementia in El Dorado County.
This is a nurse-led study because nurses lend an expertise, and especially in end-of-life care with Snowline. The nurse-led and social work-led assessments that we do, as well as the interventions, our conversations, the patients and the patients and their families will have a better understanding of their disease trajectory. And in collaboration with our palliative physician, nurses help to develop action plans and protocols for the patients and their caregivers to utilize. It's important that nurses lead this pilot study, and we collaborate with not only our palliative physician, Dr. Allenwood, but the patient's primary physician as well. So much of the care and the collaboration and the support for the patient and the caregiver relies on this collaborative relationship.
Main thing that I hope is the support to the caregivers and families. This is a very long disease and very difficult for families and caregivers, and I hope that with the support that our team can have, that the patients and caregivers will have an improved quality of life. Thank you so much for the opportunity to participate in this grant proposal.